Welcome everybody to today's session, which is part of a series of education sessions that we provide on the Integrated Stroke Unit at Mackenzie Health. Today's session is called Care for the Caregiver, and in this presentation I will be addressing not only the stroke survivors but many of the family caregivers whom we work with every day on the stroke unit. What I hope to do in my first slide, I talk a little bit about the objectives and what I'd like to do in this presentation. I would like to talk a little bit about the role and the implication of the family in the stroke rehab process. I will touch upon the emotional journey experienced by the stroke patient as well as the caregiver and families, and I will conclude with some general information on the stroke rehab team, preparation for discharge, and some basic information on community and government financial resources. I think we can all agree that stroke affects everyone in the family. When a stroke occurs, it's not just the stroke survivor that is involved, but the entire family. We have learned that for successful rehab and discharge from hospital, the whole family needs to be involved in the planning, organizing, and sometimes just physical rearranging of the home. Often, the closest caregiver has to do what any good business manager does and delegate responsibilities. It's important to think about what family members, friends, or outside resources can do to lighten the load. And remember, each family member has an emotional connection, and it is also their one way of coping with the stroke incident. In the next slide, I depict some of the emotional reactions experienced by stroke patients and their caregivers and families. Often, people who experience a sudden or unexpected illness will be unfamiliar with their emotional responses. Where they might not have been an emotional person before the stroke, they might not recognize their display of feelings and responses to events. Remember, recovery from an illness is not just physical, but emotional as well. For the stroke survivor, anxiety, loss, decreased self-esteem, depression, sadness, anger, frustration are common emotions expressed. For the stroke caregiver, feeling overwhelmed with new responsibilities is common and normal. And something we always remind our caregivers is that as a caregiver, you might now have to take over tasks that in the past were performed by the stroke survivor. You may also have to take on new tasks, such as helping your stroke survivor with daily activities and their rehab progress on the unit. I think we can all agree as caregivers, one of the most important parts of your new job is to help your stroke survivor become as independent as possible. Obviously, you are the key to maintaining their comfort, their safety, their dignity, and self-esteem. In terms of how a stroke caregiver can help in this recovery process and in dealing with some of the emotions, some of the recommendations that we have on the stroke unit is, one, to get as much information as possible from the stroke rehab team about how the stroke has affected your family member. Obviously, the more you know, the more you can help. Becoming familiar with your family member's rehab progress. Ask therapists, nurses, and doctors to demonstrate techniques. And number 3, being patient. Remember, a lifetime of learning can be lost with a stroke. It's not going to be relearned overnight, except that frustration is likely to be a big part of the caregiving role. And in terms of helping the stroke survivor rebuild his or her self-esteem, caregivers can help by emphasizing the ways in which the stroke survivor can regain his independence through participation in therapy. Include the stroke survivor in your conversations. Talk with the stroke survivor, not about him or around him or her. Keep the stroke survivor informed about family activities. Seek his opinion or her opinion and advice. Just because the stroke has occurred, the stroke survivor does not mean that the stroke survivor is no longer a part of your family and might not have opinions about what is happening in the family unit. The most important thing, don't make constant comparisons to the way life was before. Focus on the present and the positive. Encourage the stroke survivor to enjoy what he can do instead of regretting what he cannot do. And in terms of the emotional journey that stroke survivors go through, the most important thing to assist with respect to caregiver burnout is to take care of yourself. Obviously, the physical and emotional changes in a stroke survivor can mean major adjustments to the caregiver's day-to-day life. Caregivers may sometimes feel burnt out. And in order to help with burnout, it's important to look at your supports around you. Don't be afraid to share feelings or concerns with a close friend or a professional on the unit. Try to at least have one daily conversation about a topic that's not related to the stroke. So don't make the stroke your whole life event. Of course, take part in any type of physical exercise that you will find relaxing, such as Tai Chi or an exercise class. Keep up with current events, broaden your outlook, enlist the help, obviously, of family, friends, and community agencies, and most especially, take care of your physical health. In the next slide, I actually have a quotation from a family member that I worked with on the integrated stroke unit. And he talks about the loss of not being able to have a normal conversation as a result of the aphasia that his stroke survivor experienced. And we recognize that there is obviously going to be changes in the relationship and in the communication patterns that a stroke survivor might have with their spouse, with their family members, with caregivers. But it does not mean that communication stops. And I'm sure you will hear later on from our speech language pathologist on the unit a little bit about how communications can be handled through stroke rehab or on the stroke rehab unit here at Mackenzie Health. In this slide, I want to sum up a little bit of what we talked about already in terms of how you can help your stroke survivor by having some stroke education, understanding what is a stroke, what type of stroke your stroke survivor has had, what type of medical tests and treatments will they have on the stroke rehab team, on the stroke rehab unit, and what can be involved in terms of stroke recovery. Very shortly after a patient is admitted to the integrated stroke unit, we do our best to provide a book from the Heart and Stroke Foundation called Let's Talk About Stroke. It's a very helpful booklet which gives people general information on stroke education and rehab. We also we have other printed literature available on the unit that's also been provided to us free of charge from the Heart and Stroke Foundation, and we strongly recommend people to even go to the website. There's a lot of very, very helpful information that's available for stroke survivors and their family members. So I'd like to talk a little bit right now about family conferences. That is something that we handle here on the integrated stroke unit. We provide on the stroke unit close to discharge. It's sort of helpful for stroke survivors and the family members to plan for discharge. It allows patients and families to feel a sense of control in taking an active part in planning ahead. It also gives the entire care team a chance to report on what progress your stroke survivor has made and what kind of gains they will be able to achieve prior to discharge and even upon discharge with ongoing therapy when they continue in outpatient therapy. The importance of family conferences is to identify challenges early on and obviously to set some tentative discharge dates before a patient returns home. In the next slide, I have listed a lot of financial resources that have been used on the integrated stroke unit. When a patient is admitted to our unit, often I will talk to the patient and the family and ask questions about whether the patient was working. It's very important to understand that there might be some employment benefits that they might be entitled to. Sometimes people are not aware that they have employment benefits or how to access their HR department, for example, in their workplace. So these are questions that I will ask very shortly after admission to the unit. If a patient does not have employment insurance, then the next step, of course, would be to look at government programs that are available. Again, through the government, there is employment insurance. There is short-term or long-term disability through Canada Pension. Ontario Works is a government program that for patients that have absolutely no income. It's really a form of welfare, and one has to qualify in order to apply for Ontario Works, but it is available. People need to know about these benefits, and this is why questions will be asked shortly upon admission about how one derives their income. Assistive device program is a very important program that we access again on the integrated stroke unit. It is a government program that assists our stroke survivors should they require home health devices, for example, a wheelchair. The government will cover the cost, 75% of the cost of the wheelchair, 25% will be charged to the patient. What is important to know is that assistive device, one does not have to research that at the time of that the therapist on our unit will recommend a wheelchair. They will assist you in the paperwork that's required to obtain that 75% of the government. So it's not something that one has to look after or initiate the application on their own. Another resource that we talk about in terms of preparation for discharge, and certainly when a patient does go home, is housing. Some of our patients might not return to the home that they were living in prior to the stroke. So we do have a lot of knowledge on the unit about the availability of retirement homes. Many retirement homes have come up in this particular catchment area, Richmond Hill, Vaughan, and we do get a lot of we get a lot of brochures and visits from these retirement homes letting us know what they have available, and we're happy to share that information with our stroke survivors and our family members. Long-term care, some of our family members, stroke survivors, want some information about long-term care. We do work with CCAC for long-term care and placement. Long-term care is a process that is initiated through the Community Care Access Center. We work closely with CCAC. Obviously, our goal is to get our patients home, and if possible, with as many supports as we can put into the home. But if that is not working, if a patient does require more than what CCAC can provide, then CCAC can follow up with long-term care once a patient has been discharged home, and help with giving information and having family members visit and tour facilities so that they can make a choice of which facility they might choose to have. And we do have a palliative care unit here in the hospital on the 3rd floor. Sometimes our patients will ask for, family members and patients will want some information about palliative care, and we will assist within that area as well with information and tours of the unit. So in terms of preparation for discharge and when a patient is discharged home, the next slide will focus on what's available out in the community and for outpatient rehabilitation. So when a patient is discharged home, we do not suggest that therapy stop. We will actually make referrals in many cases for outpatient therapy. Two of the programs that we normally use are St. John's Rehab, and which is in North York, and another program is in Toronto at Toronto Rehab, TRI, Toronto Rehab. It's on Bayview and Eglinton. We recognize this is quite far for some of our patients, but the reason that we use TRI is that they do have speech-language pathology services. At this point, we're not always able to get speech-language through St. John's, so we do use Toronto Rehab as a recommendation for outpatient therapy, if that is required for a stroke patient in terms of communication and speech skills. The other program that we access very often is vocational therapy. Both St. John's and Toronto Rehab do have vocational therapy, which assists our patients that do plan to return to work once they return home after the rehab stay on the stroke unit. And of course, as I was saying prior, we work very closely with Community Care Access Center. So once we have a discharge date set for our stroke survivor, we advise our CCAC, which has an office here in the hospital, and we let them know that this patient will be going home on this date and will require perhaps some home care, maybe even some therapy prior to their being accepted to outpatient. And we will initiate the referral, and CCAC will actually come up and meet with our stroke patient and the family member and give some information on what they will be able to provide once they've assessed the patient and what their needs are. So they do their own assessment despite us making the referral. There's a lot of community resources we access, and I have listed them on a slide specifically titled Community Resources. So I have spoken to you about community care, which does provide, again, home care when a patient is being discharged from hospital. And again, if people want placement in the future to long-term care, again, CCAC would be the agency that would assist in this area with providing an application and providing information about what nursing homes are available in a patient's catchment area or area of choice. Sometimes our family members, our caregivers, and our survivors will choose to have additional homemaking or caregiving help in addition to what CCAC provides. So this would be private homemaking services. And again, we have a list of different agencies, different companies that do provide private homemaking services, and we're happy to share that information with you. Respite care. Respite care is a very important option and something that we use often on the integrated stroke unit. Respite care might be a temporary stay in a retirement home so that a patient has a little bit, it's sort of a bridge or a gap when a patient is discharged from hospital and maybe not yet ready to be alone in their own home. So respite is a good option. It's sort of, and the other good thing about respite, or the other advantage of respite, I guess to say, is that one has an opportunity to see what it is like in terms of communal living before even making a decision to maybe stay permanently in a retirement home or other communal living environment. So again, the retirement homes, we have lots of brochures and information about the different retirement homes that are located close by. And there are certainly many retirement homes throughout Ontario, throughout Toronto, that we also have information on. Some of the other community resources that are accessed often by our patients, both on the stroke unit and just in general, if a patient is elderly, we often will access meals, give people information on CHATS, Community Home Assistance to Seniors, that offers a wonderful Meals on Wheels program. Lifeline Emergency Response System. If a person is living on their own, elderly, and perhaps at risk for falls, we would strongly recommend Lifeline so that they have some type of emergency response service, so that in case they have a fall or they're in any type of distress. We often, upon discharge, will talk about stroke support groups. We're very fortunate to have a wonderful Living with Stroke support group that is offered through the Heart and Stroke Foundation. It's located in Vaughan at the Vaughan Community Health Center, and we will provide that information to both our stroke survivors and many of our caregivers, because it's a good opportunity once a patient has gone home to continue in a supportive environment with other people that have gone through a similar experience that they have gone through, and they are able to get even just some general information. There's guest speakers at these stroke support groups, guest speakers that address the issue of stroke and how it affects one as they continue in their own environment once they've been discharged from hospital. The last resource that I really would like to spend some time on is transportation. Almost all of our stroke survivors require assistance with transportation upon discharge from hospital. We utilize York Region Mobility Plus. This is a service for patients that might require transportation and handicap transportation. So if a patient is in a wheelchair and needs to go to a doctor, or might even choose to go to a mall or visit another family member, and they require transportation that is adapted for a wheelchair, or just transportation that where they cannot use a regular transit bus service, Mobility Plus is an excellent resource. We will initiate the application here on the Integrated Stroke Unit. So often we will approach our patients and let them know that Mobility Plus is available, and we can make an application on their behalf. It does take several weeks for the application to be processed by the York Region, but they will send the application package back to the patient. Usually the patient will receive this upon discharge, or maybe prior to their discharge, which is helpful because in that gives the patient an opportunity maybe even to go home for an overnight pass, and have the access to transportation to get them home. So I'll talk a little bit now about the graduated discharge and overnight pass, which is what I was referring to. We really recommend alleviating some uncertainties and fears by giving both the patient and the caregiver an opportunity for a trial run at home. So that's what I was saying about a day pass, an overnight pass, even a weekend pass. In order to, once the doctor feels that a patient is medically stable and able to try to go home for the day, we will let the patient know, and we will prepare medication for that day. And again, if they've already had the application for mobility, it works out well because mobility can be used as transportation home for that day. Very often, before a patient is actually discharged home, we actually recommend a pre-discharge home assessment. So what that means is we'll suggest that the patient goes home for a couple of hours. CCAC will meet you in your home environment, normally an occupational therapist, and they will meet with the patient, look at the house, and see what is required in terms of safety aids prior to a patient going home. So they'll make some recommendations, for example, grab bars in the bathroom, maybe a ramp if a patient is unable to do stairs and needs a ramp to get into the home. So it's actually a very important pre-discharge home plan, and we do recommend it for most of our patients prior to their being discharged home. So I've given a lot of information about community resources and preparation for discharge and knowing your rehab team and your outpatient plan. Now I'd like to talk a little bit about discharge from hospital. I think we can all agree that when a patient is discharged from hospital, there's going to be an adjustment to changes in their daily routines and lifestyle. There might be a shift in roles and responsibilities, so a stroke caregiver might be doing things that prior to the stroke survivor had been looking after, such as banking, shopping, cooking sometimes. But at the end of the day, all of our stroke survivors and our caregivers will be resuming family and social relationships. This is a support. We strongly encourage you to continue to strengthen your relationship with your loved one. Talk about how you feel. That's where a stroke support group is helpful. In addition to the Living with Stroke that is offered in Vaughan, there is also Stroke Recovery Canada that offers a stroke support group right here in Richmond Hill, and we can provide that information as well upon discharge. I think, again, not to be afraid to ask for help, not only from your close family members, but from friends and neighbors and relatives. And of course, you will have your outpatient or your team that will be involved in therapy post-discharge from hospital. We often, and many of the healthcare professionals on the stroke unit will remind you that stroke recovery does not stop on the day of discharge. Stroke recovery continues for years and years to follow. When we offer this presentation to our stroke survivors and our family members on the stroke unit, I actually invite a past patient to come and speak And it's very effective. I'm told this is a patient that was with us about 3 years ago, spent several weeks on our stroke unit. She had a particularly difficult, a very devastating stroke. She was a mother of an 11-year-old child. She was a full-time working parent. She does not continue at this point into work, but she talks about how her life has changed, but in a good way. And she is still able to parent her child. She's attended outpatient therapy, so she's able to share what happened post-discharge from hospital, what was involved in outpatient therapy, and what was involved in just resuming her lifestyle and her relationship with her child and her family. So we have on many occasions we have other stroke survivors come and speak on our unit. We do have very fortunate to have a volunteer who also is a stroke survivor and has been very helpful on the unit in providing a little education area of resources that's available for our patients and our stroke survivors. So if you visit during the evening, you will notice in our dining room we have a little corner. It's kind of called a family resource unit that has been prepared for you by a stroke patient. And I think at the end of the day, what all of our stroke patients, survivors will tell us as a caregiver, do not disown your own needs and remain optimistic. Optimism for continued improvement, as I said. Stroke recovery will continue for years to come. Thank you for your attention, and that's the end of this session.